Independent living. Independent living is the philosophy of self-empowerment for people with disabilities. Independence does not necessarily mean doing everything for oneself and living by oneself. The concept of independent living was born in the early 1970s in Berkeley, California. A handful of students with disabilities on the campus of California, Berkeley, saw the inaccessibility of the campus and decided to turn a wrong into a right, as in disability rights. The first independent living center was established in Berkeley, and the independent living movement has been growing ever since. There are 22 centers for independent living in Illinois. There are hundreds across the United States. One of the byproducts of the independent living philosophy is consumer control. This means consumers have direct control over the service they select. For example, a consumer who employs a personal assistant is the boss in the employer-employee relationship. As in any work environment, it is the employer's responsibility to direct his or her employee. The concept of independent living has been an important part of a larger movement for disability rights. It is based on the idea that all disabled people, including those with the most severe disabilities, should have the right to live in the community. The independent living movement advocates the removal of architectural and transportation barriers that prevent people with disabilities from fully participating in society. Service dogs. The ADA defines a service animal as any guide dog, signal dog, or other animal individually trained to provide assistance to an individual with a disability. If they meet this definition, animals are considered service animals under the ADA regardless of whether they have been licensed or certified by a state or local government. Many people with visual or mobility impairments use guide dogs to help them compensate for their disabilities. In addition to assisting people with vision impairments, service animals are also used to alert persons with hearing impairments to sounds, pull wheelchairs or carry and pick up things for persons with mobility impairments, and assist persons with mobility impairments with balance. These dogs are workers, not pets, and they have jobs to do. Always ask permission before you interact with someone's dog. Do not pet the dog or divert its attention from its work. Please speak first to the person. It is correct human and canine manners. Do not touch either the service animal or its person without first asking permission. Touching the service animal might distract it from its work. Touching the person might be interpreted as assault. Resist the temptation to offer treats to the service animal. Conversing with the person about the service animal, disabilities, and other animals you might have known is appropriate. Medication and sexuality. Certain medications can cause sexual side effects in both men and women. Many medications have severe side effects, some including impotence, reduced sex drive, trouble achieving orgasm, exhaustion, and weight gain. If a patient asks a healthcare worker about how their medication will affect their sexuality, nurses may tell the patient that they can plan sex ahead before they get intimate. They can time their medication so it is fully working when they have plans to get intimate. Patients can also use heat therapy and massage to help relax muscles, making intimacy easier. Defining different types of disabilities and their effect on sexuality. Cerebral palsy. Cerebral palsy causes uncontrollable movements that are often difficult to predict. Patients should be aware of muscle spasms. The room should be as warm as comfortable for each party because the muscles of the patient with cerebral palsy are more relaxed at warmer temperatures. Cystic fibrosis. People with cystic fibrosis have a completely normal set of hormones and therefore can enjoy a completely normal sex life. Cystic fibrosis does not change sexual desire in any way.
Individuals who have breathing problems often find it difficult to engage in sexual intercourse with a person directly on top of them. An alternative to this is to have the person on top prop themselves up with their elbows or arms and support themselves. Multiple sclerosis. Sexual planning with those who have MS can be a lot more difficult than with some other conditions because it is so unpredictable. Many symptoms of MS can impact sexuality, such as fatigue, depression, bladder and bowel incontinence, decreased or increased sensation, muscle weakness, spasticity, and tremor, to name a few. Vibrators can be beneficial to those with MS. When planning sex with a partner, ongoing communication is vital. For example, when one is feeling extremely energetic, it may be a better time to plan for sex than when one is feeling especially fatigued. Stroke. A common misconception is that having sex after a stroke will cause another stroke to happen. Although this is possible, it is highly unlikely. Survivors of a stroke experience difficulty having sex because of erectile dysfunction/vaginal dryness, immobility, incontinence, fatigue, side effects of medication, decreased sex drive, or depression. Ostomies. An ostomy is an artificial opening in the abdominal wall through which waste material passes out of the body from the bowel or urinary tract and into an external pouch. Patients should have them clean and covered before engaging in intercourse. Having an ostomy bag does not affect most sexual positions.
Catheters. Catheters are long sterile tubes that are inserted into the bladder and used to drain urine. Oftentimes, the long tubes are connected to a balloon filled with sterile water, in which the urine from the bladder drains into. Catheters can be kept in during penetration. Make sure your client empties his bladder before engaging in any type of sexual activity. The client can tape the catheter alongside his penis and put a condom on top of it, or tape the catheter to his stomach. Plenty of lubrication is needed for comfort purposes, and water or silicone-based lubrication is best. If the catheter is linked to the bag must remain in, perhaps you can suggest to take a longer drainage tube. This will allow for more mobility. You can use tape to make sure that it stays securely to his body and make sure that the tubes stay out of the way.
Spinal cord injury and sexuality. Generally, messages from the brain and spinal cord function together, but when there is an injury to the spinal cord, this communication gets disrupted. Spinal cord injuries can vary greatly in terms of how they affect sexual functioning. The specific way that sexuality is impacted depends on the degree of the injury. Generally, the greater the injury, the greater the impact it has on sexual functions. In men, spinal cord injuries can cause changes in sensation, the ability to have an erection, and ejaculations. Fertility in men is another area impacted by spinal cord injuries, but the ability to ejaculate depends on where the injury is located. For women, spinal cord injuries affect the ability to have sensation and self-lubricate. Changes in women's sexuality. Initially, after a spinal cord injury, some women experience the loss of menstruation. This does not mean that a woman can't get pregnant. Women are still able to get pregnant without menstruation because ovulation still occurs. Although not all women experience the loss of menstruation, most women with a spinal cord injury are unable to self-lubricate and experience a loss of sensation. In these instances, any water-based soluble lubrication is the best substitute. Do not use Vaseline, petroleum, or any oil-based products. Conclusion. In conclusion, this video is meant to be a guide for healthcare workers to better interact with disabled patients. It outlines how to interact with patients who have a variety of disabilities. Hopefully, it will serve as a useful resource and tool for service and healthcare professionals, and people with disabilities alike. Copyright 2012 by William Takahashi. Our website is www.ap-educators.com.